very healthy. So I want to finish my talk within a very limited time, and I will like to give a very small but important message to all of you. And being from Maharashtra, we all are practicing integrated over there, and we are lucky that we are having all our hands-on on all surgeries. So whatever we are practicing in Maharashtra, that is always integrated related with all the surgeries. And so that I will be talking about the integration of Ayurveda and India with modern science, and we see that how we can optimize the fertile window with the help of modern and Ayurveda. My PPT please. I thank you the organizers for just inviting me as a guest speaker over here, and it was a very big twist for all of you, I think. From yesterday we are just churning only one topic, that is infertility and so Garbha Siddhi Mimamsa and formation of Garbha, that is the that was our हेतु since yesterday. तो हमें लग रहा है कि हम लोग कुछ ना कुछ लेके जा रहे हैं, कुछ ना कुछ मैसेज हमारा आपकी तरफ जा रहा है. So we all are trying, all the guest speakers, we are trying our best to give you the knowledge which is very necessary in your future practice as being studying the Ayurvedic gynecologist in your area. So today we are going to see how we can optimize the fertilized window through Ayurveda. Myself, Dr. Jayashree Patil, I am professor at Dr. Patil College of Ayurveda today. And we are living in a time where infertility is rising worldwide. I am not going to repeat the topics which have been discussed before, but I would like to say that ovulatory dysfunction is due to PCOD, age of pregnancy has increased, stress has increased, and this stress-related reproductive separation is directly leading to infertility. Metabolic disorders like obesity, diabetes, dyslipidemia, hypertension at early age, and hyperprolactinemia, these are also the factors which are leading to infertility. And of course, there are some factors which are in the small cities also and which are in the metro cities also. The factors like environmental endocrine disruptors like plastics, cosmetics, pesticides, industrial pollutants are responsible for unexplained infertility. And unexplained infertility is a very big chunk of the infertility patient nowadays. It can be responsible for RPL also, abortions also, and IVF failure also. So what we are supposed to do, that we are supposed to treat the infertility, and we need to take the patient up to the delivery process where we are supposed to produce a healthy child. And Ayurveda understands fertility not as a single event but as a systemic harmony, and we know this harmony is because of the Swasthavastha. So Samadosha, Samagni, Samadhatu, and elimination of malas, and of course stability of the mind, that is going to be responsible, that is going to be a big achievement if we are treating the infertility patient. And how we are going for the examination, Ashtavida Parisha in Ayurveda. But in my practice, I have always seen that whenever we are having a proper nadi parikshan of a patient and we are seeing that the proper elimination of mala, that is apana vayu. When the apana vayu is in the pelvic cavity is only apana vayu is working only in the reproductive area and pelvic cavity. So I always insist, and my PG students also, to take a proper history of the patients regarding the elimination of malas, and I am myself go for a very thorough nadi parikshan of the patient so that I can understand what is the status of Vata. So modern reproductive medicine excels at intervention because they reach there very late because already the dysfunction has already set in and they are going to act on it, they are going to treat on it. But Ayurveda in contrast excels at restoration. Restoration means whenever the patient has come into us, that time we need to just suggest some good paricharyas for them. When the female patient is in our OPD, we need to suggest the good paricharyas. One of the speaker yesterday also insisted, जब तक वो कलिया है तब तक ही उनको अच्छी तरह के एडवाइस अपने पेरेंट्स से देने चाहिए. So whenever we are practicing as an Ayurvedic gynecologist, we need to give some suggestions to the patients or the females which are coming to us so that they will follow all the paricharyas. So that will be a powerful point from Ayurveda. So what is Ayurveda's foundational model of fertility? Ritu, Kshetra, Angu, all of you know. And the framework is remarkably aligned with modern reproductive physiology, that is ovulatory timing, endometrial receptivity, nutritional biochemistry and oocyte and sperm. So we can see that Ayurveda recognized these principles thousands of years ago and long before hormonal assays or ultrasound existed. So this I am not going to repeat, but I have found some of the more references from the Granthas, from Sushruta, Dallana and Ashtavarudya. They have added their 3 factors like Marga, disease-free genetic passage, then Krudi, illuminated pure controlled mind and consciousness, and Vata, participation of uninitiated Vata is necessary in the formation. So Ritu and Bija are the basic needs, but we need to consider all these 3 factors also when we are treating the patient of infertility. And Vata, according to me, whenever in the practice I just see the patients, I always look for the Vata factor in all the area. Angu is the rasa dhatu, and again we come to Ayurveda basic principle where Ahar rasa if it is pure, Ahar rasa if it is taken with all the rules followed by Ayurveda, then you can just have a nourishment of gametes which is very well. So the gametes are going to be formed with the importance of rasa in formation of bija, because the Shukra and Artava is the last, Shukra is the last dhatu and it is the culmination of the all metabolic processes. So whatever we need, that nature of food ingested and formation of good ahar rasa, and this good ahar rasa is going to just fulfill all the needs of all dhatu formations, and when these all the needs of dhatu formation are completed, then only proper pure Artava or Shukra are going to be formed, and then they are going to act as a pure Bija form. So modern parallels include ovarian reserve, oocyte mitochondrial function, endometrial receptivity and hormonal axis stability. So whatever the work is to be done at the HPO axis also and at the local area also, where we are going to see the ovary, where we are going to see the garbhashay, uterus as a shape. So in Ayurveda, reproductive tissue is a final dhatu, and it implies that reproductive health is not isolated, it is the mirror of total systemic health. So dhatu theory anticipates the system biology model we use today. So again we need to stick up with some Ayurvedic concepts. That concepts are going to be just very much useful in our practice, and we need to follow these concepts forever our life. So again we will see the fertile video according to modern science and according to Ayurveda science. Modern science, biomedical view, the fertile window is defined as 5 days before ovulation, which is a day of ovulation, and which is based on LH surge, estradiol peak, cervical mucus changes and oocyte lifestyle. And in Ayurvedic view, it is approximately 12 to 16, and it is the state characterized by all three doshas, that is Vata activation, Pitta predominance and optimal Kapha support. So whatever we are going to think, that is in the form of the Ayurvedic physiology, and Ayurveda describes physiological state of ovulation, not just the date. It integrates endocrine, metabolic and emotional readiness. So we will again go for cycle phase optimization. Cycle phase optimization is, we are going to think about the proliferative phase in the uterus, follicular phase in the ovary, secretory phase in the uterus and luteal phase in the ovary, and of course Raja Chakra, Rutu Chakra and Uttavyatina Chakra. So in the menstrual phase, Vata regulation and Vata is the active in this phase, and there is the whole of Vata is complete shading. So we can visit Ayurvedic interventions like Rajaswala Paricharya, and Rajaswala Paricharya, if it is followed very nicely, very regularly and very seriously, then there will not be any Vata related problems in the future, or whenever there will be the next phases in the cycle. And according to modern interpretation also, reduced prostaglandin imbalance, improved uterine contractility and lower inflammatory load. So both the science say that menstrual phase is a very pure phase, very stable phase, where the endometrium is going to be shaded and the new endometrium is going to be formed, which is we call as a Gate Purani Rajasi. So that time the endometrium which is going to form in the pure form, that must be very basic and very pure. The next phase is follicular phase, or in the ovary, or proliferative phase in the uterus, and that is nothing but a Kapha nourishment. So Rutukala is under the Kapha dominance, and that's why the aim of the Kapha is always behind the growth in the body and proliferation in the body. So there is the aim of Kapha is to build follicle in the ovary and to build endometrium in the uterus. So we can give some medicines like Shatavari, Ashwagandha or Yashtimanu in this phase for the growth of the endometrium. Still we have to be very clear with our research protocols, and we need to find out some answers for these medicines. Modern interpretation is improved estradiol levels, enhanced follicular fluid quality and better mitochondrial function in the husband. So their modern science is looking after the healthiness in the uterus and healthiness in the ovary also, and it is looking after the estradiol support in the proliferative phase and in the follicular phase. So this is the Kapha area in the cycle of the menstrual cycle. So the next area, the next phase is secretory phase, and as all of the secretions of in the body are just related to Pitta, and sex hormones like progesterone, estrogen secretions come under the action of Pitta. Not only the endometrial secretions, not only the secretory phase in the endometrium, but all the secretions present inside the body at the time of the secretory phase, they are just dependent on Pitta dosha. So apart from neurological and hormonal stimulation, many other neurotransmitters and enzymes are also involved in the act of ovulation. For example, dopamine and all that you have learned in the workshop yesterday, and you have taught them everything, Dr. Pradeep sir, yesterday about all these neurotransmitters and all. So these neurotransmitters are necessary, these hormones are necessary, and they should be in a very proper way, and that's why Pitta should be very much at the proper level, at the basic level in the secretory phase. So we need to follow the directions and we need to follow the Paricharya which is supporting Pitta. So fertile window where support ovulation and maximize conception, and where we can go for Ayurvedic interventions like Palakrita, Abhyanga, sweet and warm food, emotional calmness, asanas and pranayama. I always insist on asanas because I am a good practitioner myself. I think that I can practice yoga, and I will always advise asanas to my patients. Even at the time of the Garbha Sanskar also, we are doing all the asanas in the pregnancy. So if the asanas are started before the pregnancy, when she is in these stages, then they are going to be very much beneficial to the lady. And at this stage in the fertile window, there should be gentleness in everything. There should be gentleness in the massage, there should be gentleness in the yoga, some asanas like Baddha Konasana. These asanas, if they are practiced very much properly in this phase, then you will definitely you will have advantage of all the. And again, fertile window modern interpretation, improve cervical mucus, reduce cortisol, more reliable LH surge and enhance uterine blood flow. So for these purposes also, you can have a ayurvedic tools with us. Those are asanas, massage and some of the medicine which have proved their usefulness after the research. So luteal phase now again pitta, it is going to support implantation. Ayurvedic interventions are grounding foods, avoid fasting. We have to be very much particular regarding pitta also, and along with it vata balance also, because vata is going to help for the conception also and for the implantation also. Regarding the menstrual cycle, total menstrual cycle charya, not only Rajaswala Paricharya is important, but we need to go for also Paricharya in the Rutukal also and Paricharya in the Rutavati Kal also. So Paricharya in the Rutukal will be just Rajakal will be Rajaswala Paricharya, and after that it will be just go with the flow, that to support vata, to support pitta, and again wait for the conception. And vayu is important in all these cases because so what modern science is going to do at luteal phase, they are going to go for modern drugs like progesterone support to improve the endometrial receptivity and to reduce the stress-induced luteal defect. जैसे कि अभी विजय सर ने कहा था कि he was talking about all the luteal phase defects. So we have to be very much particular regarding the luteal phase defects also. But if we follow the paricharya particularly, if the patient is that much calm, if the patient is following the dosha-related paricharya, then I am sure that it can be always an add-on therapy for modern medicine. The psychoneuroendocrine dimension, according to the Ayurveda has recognized the mind-body fertility connection long before the modern science. Stress increases vata, vata disrupts ovulation, and ovulation disruption reduces fertility. And modern research also confirms that cortisol alters GnRH pulsatility, stress substresses LS surge, and if there is no any LS surge, there will not be ovulation, and sympathetic activation will also reduce uterine status. So that is the way where we can also help being being Ayurveda practitioners, that we will advise meditation, pranayama, gentle abhyanga, and they can directly modulate these pathways. Psychoneuroendocrine dimension is very much easy to handle if the patient is already following dinacharya, which is advised by Ayurveda practitioner. And I think that is the need of the day now. We should advise the patient for such a type of paricharyas and such a type of daily routines in their practice, so that the female will not have any further complications. So management as per the Ayurveda, if we are going to follow the cycles as dosha-related cycles, dosha-related charyas, it will be basically handled. But again we can go for if there are conditions like PCOS, endometritis, recurrent pregnancy loss, Ayurveda, we can go for Virechana, Basti, Uttar Basti. So for these purpose, we can go for further dimensions which have been discussed by other practitioners also now before me, that what is the role of the Uttar Basti, what is the role of the Yoga Basti, and what is the role of the some Ayurveda medicines in the infertility also. So here I am going to just say that modern parallels are going for the same, with the same way. They will go for reduced inflammatory cytokines, they will go for improved pelvic circulation, and they can go for neuroendocrine modulation. So now I am not talking about the modern science at all. I am talking about the way where the world is going nowadays, and how the modern science is thinking about it, and how we can help the modern science, and how we can take help of modern science also for the purpose of handling infertility patients. So here I would like to give you a message for all of you, that there should be a integrative precision fertility model, where that will be the hybrid model. The most powerful approach will be hybrid, and we can combine for ovulation product, regulator kits, cervical mucus tracking, BBT charting, and ultrasound monitoring. We can easily use these tools in our practice, and we can just make them available for us. We can go for them, and along with it, we can go for cycle phase Ayurvedic interventions, dosha specific lifestyle, rasayana therapy, Yoga Basti, and Uttar Basti. So the details of it are to be discussed. If they are to be discussed in the detail, we need a lot of time, but I am going to present here only the basic things which can be done by us and which we can follow for the treatment. So this can create a precision fertility model that is both ancient and cutting edge. So we can combine the models, we can combine both the models, and we can go for very best results for our patients. And to advance the field we need, of course we need a research-based model for their, that is clinical trials on Shatavari and follicular biomarkers, studies on Ashwagandha and LH versatility, then research on Phalagruta and endometrial thickness, then Panchakarma's effect on inflammatory cytokines, and dosha phenotyping in reproductive disorders. So these things should be done as per the modern way now, and we need to prove the world that we are here for the very concerned problem, world level problem like infertility, and we can be pioneers for helping you or helping the modern science and just taking the help of some modern tools also. So what is the Ayurveda conclusion? Ayurveda does not treat fertility as an isolated event, it treats it as the emergent property of systemic harmony, that is Swasthavastha. So by integrating Ayurvedic physiology, modern reproductive science, and psychoendocrine insights, we can go for a more holistic, effective, and patient-centered approach to optimizing the fertile window. So this is my idea to optimize the fertile window, and I think I am quite sure with my practice that we can do it very well. So but when there are any doshas or diseases, definitely we need to cure them, and then we need to follow this model. So here I will go for one case presentation. I have got each and every detail of this patient. A 30-year-old female presented in January 24 at Dr. Jayashree Patil College of Ayurveda, and she was having menorrhagia, dysmenorrhea, and dysarthria. She was married 13 years, and she has done 3 times or 4 times IUI, IVF, and lastly she had developed fibroids. And she came to us that time she was having fibroids, and we went for, this is the case paper on the month of June 24, and this is the case paper on the 15th May 25. So first she was having This was a clinical timeline of this patient. She appeared in the January 24. Then as we are having all the facilities and all the operation theatre and all at our place, we went for the laparoscopic myectomy in the February 24. Then hysterosalpingography was also done, and she had right-sided tubal block. We came to know on 7th March. Then I started Uttar Basti with Kumari Tel up to April, May and June. So we went for Uttar Basti. I went for a very vigorous protocol because it was a very hard time for her. We see her age was 38 and she had all myomectomy and all these things, and she had married for 13 years. So we went for a very vigorous protocol here. So we went for myomectomy, then HSG, then immediately started for Uttar Basti with Kumari Tel and Sharadel. The Uttar Basti was intrauterine. Then it was ended. Then oral Phalagruta with letrozole. Only letrozole is the drug which I prescribe in my practice because I trust a lot on letrozole. And all of we know now what are the side effects of clomipene. So letrozole was prescribed for 3 months. Husband's semen analysis was normal and ovulation was documented. Ovulation was also normal. But I was not successful in this part. So in December 24, IVF referral was suggested to the patient because she was under my treatment from February to December. But she said she declined. She said she will be continuing with the ayurvedic treatment, and rasayan therapy was given to her with Enriching 2 TSF was given, and in the month of May urine pregnancy test was positive. So this is a discussion that these cases had surgical correction, ayurvedic therapies and modern pharmacology. Surgical correction was done by doing myomectomy. Then ayurvedic therapies like Yoga Basti, Uttar Basti were used. Modern pharmacology that we used letrozole only for 3 to 4 months. And then I got a concept, I got a reference. The counseling was a big part for her to go for IVF, but she did not go for IVF. And then I just got a reference from Kashyap Sahita Sindhistan. विरेचनेन शुद्धयन्ति प्रसीदन्ति इंद्रियाणि च धातवश्च विशुद्धयन्ते बीजं भवति कार्मुकम. So I thought कार्मुकम may be the quality of the bija, कार्मुकम may be something else that will help us in the pregnancy, in the conception. So I was not sure, but I started the treatment in this patient for apan pacification and bija quality improvement because her age was 38. And she was I wanted to start rasayan therapy for her. So along with Shatavari and Ashwagandha, I prescribed only Eranthane, and which was supposed to be taken at night time, 2 TSF at night. And I thought the bija quality will improve. And that time she was stopped each and every treatment. December 24 she had stopped everything. We went for all the surgical and medical treatment, and for 2 months, 3 months only she had Eranthane, and her LMP was 30th March, and in the month of May she came to us and she was positive. So what is the role of apan here? That proper functioning is important factor. Spermatogenesis, oogenesis, fertilization, organogenesis depend on efficacy of uninitiated vata. So this is my message to all of you, that don't avoid or don't just ignore Ayurveda, what Ayurveda is trying to just teach you. And vata pacification is very important. And I was sure that the result was because of Eranthane, and where apana was pacified and she conceived within 2 months, because she was not on any modern or Ayurveda treatment. And Ayurveda does not include vata in the samagri, but without vata, particularly apana vata, the union, transport, implantation and development of Garbha is impossible. Conception is impossible, then continuation of the pregnancy is not possible, normal delivery is not possible. So just take care of Apayavata, giving Nitya Virecham to your patients, and that will make that lead to a wonder, which has been done in my case. So Vata can be understood as the invisible regulatory principle underlying all whole Samagri, Rutu, Kshetra, Ambo and Puja. So maturation of gametes by facilitating cell division and role of Vata in fertilization. The heat generated during coitus activates Vata, and due to combined action of Vayu and Tejas, the Shukra is ejaculated into female genital tract, where fertilization is going to occur. And Vata is responsible for assembling the semen that present throughout the body to reach the male genital tract for ejaculation. And Vata is responsible to carry semen that deposited in the vagina to uterus for the conception. So I think Vata is the most important factor, and this is the end of the patient which we saw. We can see a healthy baby delivered at our hospital only, and they were happy with that because of only Erantathel. So now we are using Erantathel as a wonder drug in our practice, in our OPD, and I advise every PG that you should prescribe Erantathel. कोई भी आएगा तो उसको Erantathel ही देना, तो उससे काम हो जाएगा, and definitely we are getting results with that also, and I am very happy that I have found such a simple way for the treatment of South. And it needs research, it needs some work done on it, it needs some multi-centric studies also, then you will be able to. But till then you can start the Erantathel for your patient and be happy with the patient. So thank you. Dreams come true when desire transform into concrete actions. And thank you very much.